Welcome. How's the week been?
Excellent.
Yeah?
Excellent.
I was at the case competition. What else has been good?
We had a hunger and poverty banquet last night and public health day all today. It's an excellent event.
Okay, that's good. Well, welcome, and it's my pleasure to introduce Julio Frenk, who is the Dean of the Faculty and the T&G Angelopoulos Professor of Public Health and International Development at the Harvard School of Public Health. I can simply say in an introduction that he is truly one of the world's eminent authorities on global health. I say that without hesitation, and it's really great to have him here. He's had a distinguished career as the Minister of Health of Mexico, for example, where he had a very ambitious agenda, which people I know at one point thought was not possible, but Julio was determined to show them that you could have comprehensive national health insurance. If you read about Seguro Popular, it really expanded health care to millions of previously uninsured Mexicans, a topic that's been in the news here of late. Dr. Frenk was the founding director of the National Institute of Public Health in Mexico, and he worked in the World Health Organization as executive director in charge of evidence and information on policy, which at the time was quite new, and trying to build a scientific foundation. And I can tell you this remains a challenge for health policy in the World Health Organization, but I think he really got the ball rolling. He has been a senior fellow at the Bill and Melinda Gates Foundation, executive president of the Carso Health Institute in Mexico City. I recently read that Mr. Carso was a little wealthier than Mr. Gates. I don't know if that's true, but I read that. And he's very much involved. He's chair of the board of the Institute for Health Metrics and Evaluation at the University of Washington in Seattle. Interestingly, although a Mexican in every way, he got his medical degree from the National Autonomous University of Mexico. He does have strong ties, not to Michigan State, so you can relax, but to the University of Michigan, where he got a Master's of Public Health, a Master's of Arts in Sociology, and a PhD in Medical Organization and Sociology. Michigan State is one of the teams in the Final Four, so I have to be careful.
Getting ahead of Gabe.
That's true. In addition to many of his, I mean, you can imagine the career he's had, all the things he's done, and those of you who are thinking of moving into academic life, he's written more than 100 articles in peer-reviewed journals, 31 books and monographs, 51 book chapters, and 13 editorials. And I read even 2 novels for youngsters that explain the functions of the human body. So I can't think of a more global health figure and leader to be with us during this week. He's been here learning about how we've been trying to build global health at Duke. He has a great challenge of doing the same in the Crimson at Harvard, and I'm sure we'll do so in a very wonderful way. Julio, welcome to Duke.
Hi, it's really a great pleasure to be here, and I really want to thank Mike Merson for not just his very kind introduction, but also for having organized this fantastic day for me. We met a few weeks ago, and I told him we were trying to build global health at Harvard, and of course I had heard of the famous Duke Institute for Global Health, and Mike is a legendary figure in the global health field, and I wanted to come and see it firsthand. So he's been incredibly generous in organizing this visit, and I'm delighted also that it's coincided with the Global Health Week. I just saw the exhibits, and I'm really impressed. And you even ordered beautiful weather for me. Having grown up in Mexico and living now in Boston, believe me, I appreciate it a lot. I'm going to give you a PowerPoint break, okay? No PowerPoints. This is a conversation, and so I'm not going to show any slides. What I want is for us to talk a little bit about the challenges of global health, because I realize that many of you are obviously very interested, otherwise you wouldn't be here, and maybe considering careers. And certainly Duke has now, with Dr. Merson, a fantastic set of opportunities around global health, and it is a time of enormous opportunity. So I want to talk a little bit about what's been happening in global health lately. What are some of the big challenges we're facing? And then tell you a little bit about where I see the international organizations moving, and what's the future of global health. And I'll interject here and there a few of my own personal experiences. But let me tell you that I've been active in this field for about 25 years, longer than most of you have been around on the planet. And I really think we are at the threshold of a new era in global health. There's a level of interest and excitement that I haven't seen, at least in all my years in global health. When Mike and I were sort of getting started, this was a field that no one paid a lot of attention to, and now suddenly it's become really a major focus of interest. I sense, now that I'm back in the university, and I could see it today with the tour I took of your exhibits, I sense a level of excitement, especially among young people. I almost see in American universities a sort of a new idealism, which is now focused around global health. And I think President Obama said it beautifully when the health reform here was finally passed. When he said, healthcare is the equivalent in the 21st century of the civil rights movements in the 1960s. So the stuff that your parents went through. This is now health, and it's not just health in the U.S. It's global health that's sort of catalyzing that new idealism. So it's a very, very exciting moment. And I think if I had to mention what's different now, I think what's really become very different about global health, and even a few years ago, even 10 or 15 years ago, is that today health has stopped being just the concern of the experts, of people, doctors, nurses, who are the experts on health. And health has become more and more a key part of the main issues on the global agenda. What are the big problems of humankind? The question of economic development. How do we build wealth? Health is at the center of that discussion. Questions of global security. Health is now at the center of that agenda. Questions of democratic governance and human rights. Health is now at the center of that agenda. And this is what I think is really very different. A few years ago, it was only the doctors and the public health specialists and the nurses and the experts that talked about health. But today you cannot be a development economist and not understand what's going on with health. Or you cannot be a diplomat. Or you cannot be, at the national level, a minister of finance and not understand the important role that health plays in creating economic growth for your country. So to me, this is the difference. And I am sure that for all of you, the undergraduates in this room, health, global health in particular, and by the way, I don't think there's any distinction between all health is global health.